Eleanor Britton describes herself as a country girl at heart. Growing up on a dairy farm gave Eleanor an appreciation of the natural environment. She enjoyed helping with outdoor chores and loved the freedom of farm life. Eleanor witnessed the hard work put in on the farm by both her parents, Anne and Tony. Eleanor's mother, Anne, was always able to provide and would become quite an influence on her, equally as much as going to the cricket with her dad every Saturday, which is still a favourite memory of hers. The sport-loving Eleanor would have loved to play cricket herself, but at the time it just wasn't an option for girls. At Warrnambool Primary School, many of the students were Eleanor's cousins, and many of them later joined her as students of CBC and St Anne's, where her love of all sports saw her appointed as St Anne's sports captain in her senior years. In the years following school, Eleanor did some travelling and tried her hand in a couple of different industries before meeting and marrying Eleanor Britton, who was a new teacher at St Anne's. At that point, Eleanor had no idea how important healthcare would become in the lives of her family. Eleanor and Ian's first child, Chloe, became seriously ill. At age 6, Chloe underwent a liver transplant at the Austin Hospital. Following the transplant, Chloe continued to suffer from infections, and her physician suggested that a move to a warmer climate may help to break the cycle of infection. Eleanor, who at the time was a business manager at Panmure Primary School, and her family packed up the car and relocated to Western Australia for what they thought would be a temporary stay. Chloe thrived in the different climate, and Eleanor and Ian loved the environment, often taking the opportunity to explore. On a road trip through Central Australia, they appreciated the beauty of the land they were on, but they were shocked by the contrast of the living conditions of the Indigenous peoples. They felt shocked and embarrassed that, as privileged and educated Australians, they were so ignorant of the conditions that existed in their own country. These experiences were to have a significant impact on Eleanor's view of the world. At the time, she was working as the business manager of a medical practice and began to think more and more about access and equality in healthcare. In 2011, an opportunity arose to work with the not-for-profit community-based organisation GP Down South, which at the time ran a small general practice for vulnerable and marginalised young people. The work of GP Down South focused on mental health, Indigenous health, chronic disease management, youth health, and drug and alcohol issues. Eleanor's knowledge of the deep divide between those who have a lot and those who have little became more extensive. She witnessed high levels of youth unemployment and youth suicide in the local Peel region. Seeing a need for more comprehensive healthcare, Eleanor was instrumental in the development of some key programs for the Peel region. One of these was an outreach bus, the Peel Mobile Health Service, which she took to the outlying areas, providing free counselling services and distributing information on issues such as drugs, alcohol addiction, diabetes, diet, and mental health issues. A keen interest in mental health led Eleanor developing a flagship program for secondary students, the Tier 3 Youth Mental Health Program. The program was designed to remove the stigma associated with talking about mental health and to give young people the tools and language that they needed to help them talk about the issues they were facing, gain the courage to seek help, and to provide one-on-one clinical intervention, awareness raising, prevention, and intervention. When the region faced a spate of youth suicides, Eleanor was propelled into action. In 2015, Eleanor proposed a one-stop shop concept that would see a range of service providers working together to remove barriers to access and provide immediate help and achieve better health outcomes for everyone. As nothing like this existed nationally, this idea was first met with some skepticism and resistance. Eleanor had to be absolutely relentless in her pursuit of funding, sharing her vision, and seeking support from all levels of the government. In 2017, Eleanor led a public campaign and petition, gaining thousands of signatures and successfully lobbying the federal government to award a headspace centre in Mandurah, under the condition that they be located in the Peel Health Hub, under a co-location model of care. Ultimately, Eleanor's persistence and hard work paid off, and she succeeded in gaining bipartisan support from federal, state, and local governments. The $9.8 million Peel Health Hub opened in December 2018, on time, under budget, with 9 co-locating organisations offering a coordinated response to health issues. The Peel Health Hub was recognised as a unique model of care that would be closely watched around Australia as an outstanding example of innovative healthcare. Decades after leaving St Anne, Eleanor's dream of playing cricket was finally realised. Encouraged by her youngest daughter Melanie to give cricket a go, Eleanor now opens for Rockingham Mandurah in the WA Premier League. Chloe, a girl who was so ill as a child, is now an ICU nurse at a leading Perth hospital, often having the opportunity to support others who are undergoing organ transplant. Chloe has also given Eleanor and Ian a beautiful and healthy grandson, who is now 7 years old. In 2019, Eleanor Britton was officially inducted as a local legend by Mandurah City Council. Eleanor was recognised for her unwavering passion and dedication to improving health services for youth, and as the driving force behind the development of the Peel Health Hub and its collaborative model of care. Mandurah Mayor Rhys Williams said that Eleanor was an extremely deserving recipient of the award, having spent countless hours dedicated to lobbying. Eleanor gave real heart and soul to the plight of having our Peel Health Hub built in Mandurah, as well as many other programs and services she has worked so hard to secure for the young people and vulnerable people in our community, with these people now having access to vital support services at the hub, which is absolutely paramount to our community. Her passion definitely shines through.
Well, thank you everyone for your warm welcome. I think that's probably said it all. I probably don't need to speak anymore now, but I will. I do feel rather humbled to be here tonight and receive this honour, so thank you. I often wonder what the big deal about the Peel Health Hub and our model of care is. It's simple and it works. But I guess it's occasions like this that allow you to stop and reflect on the journey, on how we get here and what we've actually achieved. In challenging the way healthcare is delivered, in improving access to services, reducing barriers and supporting young people seeking help. I know that over the almost 5 years since the Peel Health Hub opened, that we've saved the lives of many young people. I'm lucky to have had a wonderful family life, growing up on a farm, attending the Ringall Primary School, and then what seemed to me at the time a huge leap to the metropolis of St Anne's College, where I was probably noted as a quiet but determined student. I enjoyed my time at St Anne's, made many lifelong friends, and look forward to each of our 10-year class reunions. Number 40 is next year. Although a very stressful time, I remember clearly when our eldest daughter went through her liver transplant. Our networks and communities, including the St Anne's and Emmanuel community, all rallied around us and supported our family. We experienced the best care, we met the most amazing people, and through this experience, the physicians, the surgeons and the nurses, they went above and beyond their jobs, providing world-class and cutting-edge healthcare. They made what was a horrendous experience also one of the best experiences of our lives. We saw humanity at our best. We can never thank all these people and our donor family enough. I want to also tell you about another experience we've had with health, an experience with the most insidious and the most deadly of all mental health issues. Help was sporadic at best, and there was little communication between health professionals. We tried GPs, psychologists, psychiatrists to no avail, many even admitting that this was way outside their expertise and scope. There were lengthy wait lists and massive fees, and we felt we were bouncing around the system. There was no readily accessible program to support any of us other than hospitalisation and medical intervention. It felt like a shameful disease and nobody wanted to name, far less treat, an eating disorder. I worked in health at the time and understood the system, had the affordability to pay and could not access care when we needed it. We eventually got help, not the right help, but at least it was something. It took many years of persistence, often weekly travel to Perth, huge fees to access help for the eating disorder. And by the way, an eating disorder is the most serious and complex of all mental health illnesses, and 12 times more likely than any other mental illness to end in suicide. In 2015, the Mandurah and Peel community was shocked by a spate of incredibly tragic youth suicides. How are these young people falling through the cracks of our health system and ending up in this situation? If these young people were given a referral, did they follow through with that? Or was it just too hard? Who followed up with them? And did they make an appointment? And if they did they turn up for it 3 months later? Did they even know what they needed, what was wrong with them? Surely there had to be a better way. In my mind at this time, we had to do something. If you break your leg, actually, let's say if you need a liver transplant, you can talk about it with family and friends, and the community supports and rallies around you, and you receive, as in our case, the best possible care. On the other hand, mental illness carries stigma, can be shameful, very few people understand it, and help is disjointed. Our treatment of physical and mental illness is poles apart, and our family had witnessed this firsthand. The idea to address these issues in our community was the Peel Health Hub. What if we could get like-minded organisations working together under the one roof, working under a model of care where we break down the barriers to help seeking, reduce the red tape, work together for the benefit of the young person, where no one is turned away when they ask for help, where when a young person who may have been struggling with mental health and drug and alcohol issues for a long time, maybe months, maybe even years, where when they finally get the courage to ask for help, they are welcomed and can access support then and there. Not given a referral, a piece of paper with a phone number, or being told they don't fit the service, or that there's a 6-month wait, or that there's in fact a $450 out-of-pocket cost. A place where they don't have to repeat their story time and time again as they're passed from one service to another. A place where we support them in a non-judgmental way to access all the services they need when they need them. A place that tries to close the gaps so that so many people suffering mental health issues fall through. A one-stop shop for the health needs of young people in our community. Would this work? Is this even possible? The answer is yes, we know it works. In fact, we were told last week by a prominent Member of Parliament that the only problem with the Peel Health Hub is that it's too successful. The Peel Health Hub has established itself as a major health service provider in the Peel region, with door counters recording 66,000 people entering the facility in the last financial year. This is a huge achievement, but there's still so much more to do. We are a product of our environment, so I'd like to thank this community, the St Anne's, CBC, Emmanuel community. I'd like to thank Mum and Dad, Anne and Tony, and all my extended family for being wonderful role models and for being family. I would also especially like to thank my husband Ian for always supporting me and putting up with my tenacity and dogged determination to follow my ideas no matter how difficult they seem. Thank you all again for this honour and award tonight.